Hello, welcome to the Inside Knowledge podcast for people with IBS. I'm Anna Mapson, and this is episode 162. Today, we're talking about the difference between IBS and SIBO and what you can do. And I'm going to give you some practical tips and things that you can understand and then take to your doctor or learn about to manage your digestion better. So the acronyms we're talking about, SIBO is small intestine bacterial overgrowth. And that means that you have too many microbes living in the small intestine. Normally, we have a lot of microbes in the large intestine, some microbes in the small intestine, but we shouldn't have that overgrowth. IBS is irritable bowel syndrome, and most people have heard of that. But SIBO is less well understood by medical professionals and also by general public. So I wanted to do this session to really talk about the differences and give you some things that you can do to try and understand it better and work out if it's a problem for you. We have some microbes in our small intestine anyway. That is okay. But when you have an overgrowth of them, you have too many microbes and potentially some specific types of microbes, what happens is you get a great deal of fermentation. So as soon as your food comes out of your stomach into the small intestine, it's starting to meet this overgrowth of microbes. They're fermenting anything that's got any fiber, any sugars, basically any sort of carbohydrates. They are eating it, they're enjoying it. But what that's doing is creating a lot of gas, bloating, sometimes abdominal pains. The microbes themselves, the presence of them can interfere with your normal digestion processes. So, for example, it can interfere with the way that nutrients are absorbed in through the cells. Bacteria might reduce the production of digestive enzymes, leading to more fermentation because the food is not being broken down properly. So they can really get in the way of our normal digestion. Now, SIBO can be controlled through normal motility of the small intestine and normal digestive juices. And the motility, what I'm talking about is food moving through the small intestine. So big lumps of food coming through when you eat a meal. That is normal and it helps to regulate your digestion. In between these meals, we have a pause from eating. And during that time, we have something called the migrating motor complex, or MMC, and that sweeps through the small intestine, clearing things up. You can think about it like a little housekeeper, cleaning up debris, old bits of food, dead cells, bacteria, the things that we no longer need, and it's sweeping through, keeping it clean. If that process is damaged for any reason, then you are more at risk of SIBO. That's the overgrowth of bacteria. So that is one thing, is motility. And I'll talk a bit about how that can be damaged in a minute. Then the other thing that helps to keep your small intestine clean or with the microbes reduced is production of stomach acid, because that kills off a lot of bacteria in our stomach. So we eat food that might be covered in microbes, but our stomach acid is one of the first layers of defense and helps us reduce microbial input. One of the ways that you can get an indication of stomach acid is to do a test on your gut microbiome and see how many of your oral species are ending up in your poo, which should be quite minimal, because you shouldn't have lots of bacteria from your mouth ending up in the poo because they should have been killed off in the stomach. Anyway, that's a little side. You have stomach acid, that kills things off. Then you have natural production of bile. Bile is really important. It is part of the MMC. It's part of that sweeping, cleansing wave that happens when you don't eat. And it also helps to keep it antimicrobial in the small intestine. A combination of these factors is how we protect our body from overgrowth. Now, I mentioned that the motility can be damaged and that migrating motor complex can be damaged. And one of the most common ways that will happen is after an incident of food poisoning. Sometimes when we come into contact with a bug like salmonella or E. coli, maybe you've eaten some chicken or prawns that weren't quite cooked or a dodgy kebab, then what happens is your body draws a lot of water in to try and flush out this pathogen. Your body's like, oh, there's something bad here. Through this process of the immune system washing away your insides, you will then vomit and you will have diarrhea. And that's how we're getting the bug out. But through this process, we can slightly change the immune system in the gut. And what can happen is then sometimes your body is responding to the antibodies that your immune system is producing. And some of the antibodies are very, very similar to one of the proteins that controls the motility, controls that migrating motor complex. So if you've had a really bad incident of food poisoning, or you've had food poisoning multiple times, or maybe you lived in a place where the water was not clean and you had multiple infections and parasites and things that upset your gut, then potentially you are more at risk of having SIBO if that process was damaged. Okay, so we also know that this can happen, and sometimes it's not SIBO as such, but it's called post-infectious IBS, and it's about 20% of people who have an infection as their cause. So it really is common in IBS as well. So that's a bit about SIBO. What it is, it's an overgrowth. It happens due to changes in our defense systems. So when our defense systems cannot sustain the onslaught of microbes coming in for whatever reason, then you have this overgrowth. And what it causes is excessive fermentation in the small intestine. And that fermentation can create gas. It can create bloating as a result of that, pain, nerve sensitivity, feeling nausea. It's quite common as well. Plus, the actual gases that are produced can then have another negative response on your gut. They can also affect the motility. For example, high levels of methane gas that are produced can sometimes then slow the gut down even more, creating more constipation. For other people, hydrogen sulfide, for example, is actually quite, I don't want to say toxic, but it gives people brain fog, for example. Some people feel that it gives them joint pain. Like, it can be more systemic than just in your gut. The symptoms that I've just described, right, they're very, very similar to IBS. And you cannot tell whether you have IBS or SIBO just from my description. You might think, oh, I did have food poisoning, or yeah, I've had other things that may be affecting my gut motility. One thing I didn't mention is medication. Certain medications also put you higher risk of having SIBO. So, for example, taking a proton pump inhibitor, and listen to my episode 60 about reflux and proton pump inhibitors and SIBO. There's some good information in there. But basically, that's just reducing your stomach acid. And if you're doing that, you're reducing your defense against some of the microbes. If you take some painkillers, for example, they are also common to slow down the gut, and that can lead to bacterial overgrowth. So there's a number of things. It doesn't mean that you shouldn't be taking them, but it just could be an explanation for how you've got to where you are. IBS, on the other hand, is often a diagnosis of exclusion. We do have a diagnostic criteria called the Rome 4 criteria, and that is how doctors should be understanding whether you have IBS or another condition. And ultimately, they need to make a decision on which tests to run to rule out other conditions. I don't want to say more serious conditions, because people I work with, their IBS is really serious and it massively affects their life. But what it doesn't always necessitate is treatment, as in medication. So just because you have IBS, we don't know necessarily which medication will suit you or which diet will suit you, because the symptoms are so varied. Some people could be no bloating, but loads of pain and nerves pain, and maybe they get a lot of gas. Other people get no gas, no farting, but they feel a lot of pressure in their gut and sensitivity, and they get diarrhea. It's so different what people's experience will be of it. And so IBS is quite a catch-all category, but there is this diagnostic criteria, which is about having changes in your bowel movements, often having abdominal pain. That is a big part of it, and having these symptoms consistently. So it's not that you just had constipation for a week and then you're okay again. It's much more about, over the last 3 months, have you had an incident that's affected you, at least once a week? How is it affecting your life? How is it playing out? And what's it changing with you? So these are really important distinctions. But the symptoms might be very similar. So you could have all the symptoms of having IBS, but actually it's being caused by microbial overgrowth in your small intestine. And the only way you will know this is if you test for SIBO. The test is not without fault, I would say. It is the best thing that we've got, but it is not foolproof. There are errors that are known to happen within SIBO testing. So the way that you test, it's quite a strange thing if you've never encountered it, is a breath test. And what they're doing is measuring how much of the key gases are in your breath. So it is hydrogen and methane, because our body doesn't naturally produce a lot of that. And the reason it gets to your breath is that when you have a lot of gas in your digestive system, some of it will diffuse into your bloodstream. It will just get into the blood, and then it gets circulated in the blood into your lungs, and we breathe it out. So what we're going to do is to eat a very low fiber diet for one day. Just rice, chicken, fish, no fiber. So you've got no fiber in your small intestine, none in your stomach. You're kind of clear for 24 hours. Then you're going to fast overnight, have no food at all in your system, just water. And then you're going to drink a little sugary solution. There's lots of options for this, and I do talk about this in episode 103, which is about how to get tested for SIBO. So if you're interested in understanding more about this, I go through the whole process, the diet prep, everything you need to know. It's really good if you need to do a SIBO test to listen to that episode first. Now, when you drink the sugary solution, normally lactulose, this will then start feeding the microbes if you have an overgrowth. So we're going to breathe out into these little bags every 15 or 20 minutes, depending on your provider. And that will then see how much of these gases you have in your body and how long it takes for the gas to rise. And then you get a report that shows you the graph with the gas levels for hydrogen and methane. So there is no diagnostic test in that way for IBS. But this is one way you could rule in or rule out SIBO for your symptoms. Because if you know that you have SIBO, and sometimes the tests need careful interpretation alongside your symptoms, it's very hard to just look at a test and say, yes, positive, or no, negative. Because you really need to understand the person's picture. You need to understand what they felt during the test, what they felt before and after, how they normally feel, like what their actual underlying symptoms are, and what they're trying to resolve. So you can't just look at the numbers often. I mean, sometimes you can, sure, but a lot of the time it is more important to think about the whole picture. And as well as managing SIBO, which I can tell you a bit about now, but there are other things I want to come back to, which is your overall health. Like, how is the rest of your body? Is it just symptoms in your gut? Are there other problems around your health that need to be taken into account? And that puts together the picture. But the important thing is, if you do have SIBO, there is a treatment plan that is possible off the back of it. A doctor can provide you with antibiotics tailored to the types of gases that you have. This can be very hard to find on the NHS, but not at all impossible. There are specific types of drugs that support different types of microbes, and it's worth seeing if you can get the test on the NHS, and it's worth seeing if you can get treatment on the NHS, but sometimes people have to pay privately. And that can be quite expensive. So it is not easy, but I think it is worth it if you've got to a place with your IBS where your symptoms are not improving. Now, I do not think if you've just been diagnosed with IBS that the first thing you should do is get tested for SIBO. No way. So around 34%, I think it is, of people with IBS are thought to have SIBO. So there's a whole 70% who are not going to have SIBO. And they're rough estimates. Like, I've seen research saying that anywhere between 4 and 78% of people who have IBS tested positive on a breath test. I don't think those always have been reproducible, those numbers. So the most common numbers that I'm seeing in research, that's a third of people, 1 in 3 people will have SIBO, as a cause of their IBS. Now, the other kind of confounding factor is you can have SIBO and you can have IBS, and that makes it much more difficult to understand. So if you knew you had SIBO, then you could get the treatment. There is a high relapse rate, so once you've treated it, sometimes you will need to do it again and again. And my experience with this is that you normally have to address some of your eating practices, your diet, and not to avoid too many foods, because if you try to just manage it through killing off microbes, you're often more likely to relapse. Now then, just to finish up, I wanted to talk about diet for people with IBS and SIBO and what is the difference. So assuming that you know you have SIBO, you may be going down many rabbit holes looking for dietary information and what should you eat if you have SIBO. And what you will find is that you must be low FODMAP. You must be even stricter than low FODMAP in some cases. Things like the SIBO biphasic diet, low fermentation diet. And honestly, this does not have any evidence to back it up. We do not have any evidence that says this is the best diet for SIBO. What we do have, for example, is an understanding that certain symptoms are made worse when you have more easily available high FODMAP foods. For example, you might feel worse if you have a nice rich meal with lots of lentils, tomatoes, mushrooms, followed with some grapes and, some ice cream. So that would be quite a high FODMAP meal. Maybe it's going to make you feel bloated. It doesn't mean your SIBO is going to get worse. It doesn't mean your treatment won't work. So diet is a big unknown, I would say, and people talk so confidently about SIBO diets online, and they don't have the research to back it up. There just isn't anything about SIBO diets online in terms of doing clinical tests where we're checking, do people's gas levels go up or down with certain foods? It doesn't exist. So people who are telling you you must be low FODMAP in order to control the microbes or to treat SIBO is unfortunately not true. Now, my approach when I'm working with my clients, which is the same for people who have IBS, is to try and get you eating as broad a diet as you can tolerate. Now, I'm not saying everybody who has SIBO should be eating all of those high FODMAP foods all the time. We don't want you to feel bad. I want you to try and get through the day without feeling really bloated or in pain. Don't want to trigger extra diarrhea, for example. But when you over-restrict highly prebiotic foods, what you are doing is starving your good gut microbes in the long run. So you don't need to have a perfect diet every meal. You don't need to be eating prebiotic foods every meal. But when you have been low FODMAP for years, or even stricter, which most people with SIBO are a lot stricter than FODMAPs, and they're following these different kind of SIBO diets, you remove all the fermentable fibers. And that does reduce potentially your SIBO microbes, but it also reduces the good microbes. And I cannot stress that enough. I have got a new course out, which is called the Low FODMAP Diet Exit Plan. And it is for helping people who've had long-term restriction of fermentable fibers get it back in your diet. And I really feel so strongly about it because I've seen massive transformations in people who restrict and get smaller and smaller range of foods they can tolerate. And they're doing it because they're scared that every time they eat something, it's making the SIBO worse. And that leaves them feeling really, really trapped. You can reduce SIBO whilst you're eating fermentable fibers. You can eat carbohydrates when you have SIBO. You just have to find the right foods that you can tolerate and do it in a really careful way. Listen to last week's episode if you want a little bit more on diet. But I just wanted to really stress that. The same thing is with IBS. Yes, the low FODMAP diet helps, and it helps you by removing a lot of foods, gives your gut a rest, and then gradually we've got to introduce the fibers back in. We've got to bring them back in again in order to test whether certain food groups and FODMAP groups are an issue for you. And if they're not, then you should be eating them. All right. So unless you've got an allergy to them or you don't like them, You should be having a range of fibres, vegetables, fruits, pulses, nuts, grains in your diet. There is no reason that you have to be low carb because you've got IBS or because you've got SIBO. So in terms of the diets for SIBO and IBS, I don't really see a difference. It's all about managing your symptoms and getting to the biggest diet that you can tolerate without a flare-up, right? So there's a careful reintroduction process. If you're someone who has avoided all these foods for a long time, then please do check out my course. It really gives you everything you need, all the tools to reintroduce foods and understand more about your gut microbes and how they react to fibre. One of the things about SIBO is that it can be treated, and there is clear antibiotics, and the other option is to take supplements that also reduce microbes. The research around this, I'm going to be really honest, is not as strong for antibiotics, but it can be successful if you don't want to take antibiotics or you can't access them. So do see episode 40 all about diets for SIBO, where I go into this in a lot more detail. Go back and listen to that if you need to. In terms of the overall management though, a lot of what people focus on with SIBO is killing microbes, trying to get rid of it. And what they need to focus on a lot more is their overall health. Are they meeting all their nutrient requirements? Are they eating enough food to sustain them? Most people I work with tend to be underweight, not eating enough, because every time you eat, it's scary, feels horrible and creates pain. So you avoid it and you eat less. But ultimately what that does is it changes the physiology of your digestion over time. It gives you nutrient deficiencies, which can also then lead to symptomatic issues, like you may get changes in your nerve sensitivity, in your energy levels, if you don't have the right nutrients coming in. It's not as easy as just eating less and hoping SIBO goes away. And it's pretty much the same for IBS. You can actually start making your symptoms worse or give yourself new symptoms because you're not eating enough. I have also done an episode on erratic eating patterns and how that can affect your digestion. Just look for episode 24, which is called Are Abnormal Eating Patterns Impacting Your IBS? And that will share a little bit more with you about different ways that the way that your eating habits can be potentially affecting your digestion. So where have we got to? I hope this has given you a little rundown of the differences between IBS and SIBO and the similarities, and a little bit about what you should do. If you need help with working out what to do about IBS or SIBO or any of it, then you can work with me over 3 months. I have a program called the Gut Reset Program, and it's weekly calls to begin with. We get so much time. You can ask me all your questions, and you can also message me in between the sessions. So I'm really available to you, particularly in the first month. So we get to know each other a lot. And in that time, I will give you a nutrition plan. I will tell you what to eat. I will help you to reintroduce foods. I will look at your supplements and advise you on that. And so there's a lot we can do to try and increase your gut diversity. Remember, going back to that large intestine microbes, we want to make sure they're more diverse, they're healthy. And the best way to do that is to reintroduce foods. But if you're feeling stuck with how to do that, either check out my low FODMAP diet exit plan or get in touch with a discovery call to inquire about working with me. Okay, if you've enjoyed this episode, please would you leave me a review, subscribe to the podcast so you get next week's episode in your feed, and please let me know if you've got any questions about anything I've covered today or another topic you'd like me to talk about. Thanks so much for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.